The number one thing is that this procedure is never a cure-all. It is simply a tool that can be used for the benefit of weight loss. Now, when we look at people after surgery, for the first year and a half, maybe 2 years, they'll have no appetite. Their food choices will change, and that really helps accelerate the weight loss. But it is all up to the patient following a diet afterwards to maintain the weight loss. So things that will be different are we're going to restrict how much you eat in the way of carbohydrates. We're going to encourage a lot of protein intake. We will encourage you to be drinking plenty of water. There may be some habits that you have that you're very comfortable with. Those are going to probably be going away. The patients that accept those changes are the ones that are successful. Those that think that they know better than those of us that have spent years training on how to do it are the ones who usually fail. After surgery, you cannot eat whatever you want. You will be eating normal food. You'll be encouraged to drink plenty of liquids. From a food standpoint, you're going to eat protein, so it's going to be a lot of chicken and fish and steak. There will be vegetables and dairy, but we're going to restrict you from eating carbohydrates. After surgery, you're not going to eat candy. You're not going to eat pasta and bread. Those are in place so that you don't regain all the weight. Those are very important to follow, and if it's something that is so important to you, you just should not have bariatric surgery. So after the surgery, you will not be hungry at all. You'll have to remind yourself that you need to eat. We still want you to eat, so you still need to be eating 3 meals a day. The total amount that you can eat varies depending on the procedure and the patient, but they often, early on, can only eat 2 ounces at a time, but as time goes on, it's usually 5 or 6 ounces that they can eat at a given time. The hunger will be completely gone, so that is never really an issue. I think the hardest thing for patients is that there are things they can't eat anymore, but they still emotionally miss those foods. So one of the interesting things is that a lot of patients find that people within the family actually lose weight also after bariatric surgery, and the reason is that everybody tends to eat healthier. A lot of us see that when we go on a diet and we lose some weight, we get motivated when we see the scale changing, but when the scale isn't changing, we sort of slip back and just do what we've always done. So these patients become very empowered by the fact that the scale is changing. They want to do more physically and are much more active. So what actually happens is that the family starts eating healthier, they become more active, and so there's a circumferential effect on everybody that they all lose a little bit of weight and get healthier.